Hi there, I'm Dr. Sarah, and I just wanted to go over some common patient questions and concerns regarding dry eye. First, is it true that dry eye seems to be more severe in the winter months as opposed to spring and summer? And yeah, I mean, we do tend to see increased dryness in the winter. There's less humidity in the air, the heat's on. Not only does it dry out our skin, it dries out our eye tissues as well. So especially here in Michigan, we tend to see, as soon as we turn our heat on, dryness definitely becomes more of a problem. Having a humidifier in your house or even in your bedroom can sometimes be helpful to address that issue. When should a person come in to see their optometrist for dry eye symptoms, and when is it enough to take care of this problem yourself? I always recommend coming in to see your optometrist. There are a bunch of different types of dry eye. There's a million different treatment options when you go to, to the store. The shelves are just lined with different dry eye drops, and sometimes it's difficult to make a choice. And not all of those products are the best product for each individual person. So anytime you're experiencing symptoms of dryness, which include an actual dry, scratchy, gritty feeling, burning, redness, tearing even, you should have it looked at. Come on in, we'll take a look at you, and we'll see what we can, we'll, based off of our exam findings as well as your symptoms, we'll provide a treatment plan that's appropriate for your particular type of dry eye. And that leads into what is the examination like to determine if someone has dry eye. We check vision. Sometimes dry eye can cause fluctuation of vision, so we'll check vision. And then we also examine you with a microscope, our slit lamp, which is behind me here. So we take a look with the microscope. I examine the tear film, I examine the glands on your eyelids that release oils to the surface of your eye, which are super important in preventing dry eye. Oftentimes I'll put a little dye in your eye that helps me better evaluate the tear film and how it moves across the surface of your eye. And it can also kind of highlight dryness or dry spots on the surface of your eye. So we check vision, we take a good look with a microscope at the front surface of your eye as well as your eyelids, your eyelid margins.